Hey guys, it's Tamara. I'm back with another video this week. We're going to start our Monday off by talking about multiple personality disorder. Thank you so much for being with me on my channel for those of you who are subscribed. And for those of you who are not subscribed, I encourage you to go ahead and hit the subscribe button on the side there. So then that way you can stick around for all the topics that we're going to be covering this year. But today we're going to be talking about multiple personality disorder. The benefits for you today in this video is that you're going to learn about multiple personality disorder. I'm going to define it and explain it a little bit for you. And then all this week, we're going to talk in depth about this particular disorder. So let's just go ahead and jump in. So what is multiple personality disorder? I'm sure that you can type that into YouTube and Google and you can come up with a bunch of explanations. And some of those explanations sound really far out there, whereas other explanations sound more clinical. From what I see on YouTube right now, the definition and explanations of dissociative identity disorder, which is what it's currently known as, it seems more like a pop psychology thing, right? Like, hey, let me get on YouTube and just show how many personalities I can change into, or let me try to explain it to you, but let me give you an overly positive perception of what it is to kind of knock out stigma. And while I understand that, and I'm 100% for getting rid of stigma, I think sometimes the definition and the characterization of dissociative identity disorder, previously known as multiple personalities, it kind of minimizes the issue and it makes things appear less problematic than they really are. In fact, multiple personality disorder is a chronic, long-standing disorder. I'm going to post a copy of a video on narcissism and the neuroscience of personality disorders that I did a couple of videos back. And my whole point in discussing the neurobiology of personality disorders was that I'm trying to help you see that personality cannot be changed. It's the way the brain has been developed. It is the way that the person's genetic codes and DNA has been designed. Personality is something that you cannot change. It's pervasive, it's chronic, it's long-standing. It's not a mental illness. So when you think of multiple personality disorder, think of it as a personality, but a variety of different personalities. It's something that you can't medicate. Now, you can medicate the symptoms of a mental illness like depression, anxiety, maybe OCD, that may be associated with multiple personality disorder or dissociative identity disorder, but you cannot medicate DID, dissociative identity disorder. It's impossible. There's also no cure. Okay, I think that's really important to understand that there's no cure for multiple personality disorder. In fact, the only goal in therapy is to help the individual see what has happened to them, provide education, treat any other mental illness that may be accompanying DID, like depression, anxiety, OCD, integrate those personalities so that the person can live as normal and comfortably as they can, and then management of the symptoms over time. So those are really the goals for treatment if you have DID. Now, fewer than 200,000 people in the United States have DID. Research suggests that it's rare, but if you talk to somebody who has DID, I think you'll be able to see that it's not as rare as it appears, right? A lot of people think that it's rare, but for the most part, it isn't. It's probably more underdiagnosed than it is rare, okay, if that makes sense. It's important also to understand that multiple personality is not just switching personalities. It's something that automatically happens when the individual is either under stress, feels trapped, overwhelmed, or in some fashion needs to protect themselves. That's when the switch, right? It's called the switch, happens. And that's when another personality takes over so that the main character, whoever that main character is, it's typically the person who has been abused or has identity confusion. When they are feeling threatened, that's when the switch happens, right? So you can have more than two personalities. If it's one or two personalities, most likely it's not multiple personality disorder or DID. You really do need two or more personalities to have the diagnosis. Now, there's no brain scan, there's no medical test that can be done to be diagnosed with DID. It really is a psychological and psychiatric journey between the therapist and the client. along with a backstory, a history, genetics, all of those things must line up, right? All of those things must line up in order for the individual to be diagnosed with DID. Now, you're probably wondering how many personalities are there typically, and I can safely say, having experienced maybe 1 or 2 cases with DID, and these were mainly children, that's even more rare. I can safely say that an average number, and according to research as well, an average number of personalities is between 13 and 15, but there have been some cases that has involved over 100 different personalities. And I'm going to post some of those videos down in the description box for you so you can click on those and get a little bit of information. But, you know, less than 100 is typically the average, and it's between 13 and 15 personalities. But there have been some rare cases where more than 100 personalities has emerged or shown up. So what is it? You're probably wondering, what is it? Well, I'm going to say multiple personality disorder or dissociative identity disorder is basically extreme dissociation. It's pulling away, and I'm going to post a video up here where I talked about dissociation in the past. It's a pulling away from reality, right? It's a detaching from reality. There's extreme dissociation to the point of complete immersion in a different person, a different mindset, a different character, different desires, needs, wants, interests. You know, it's really interesting how this happens. The mannerisms of the person, the eye contact of the person, the vocal tone of the person, and sometimes even the facial expressions or the affect changes in such a way that you intuitively sense this is a different person. I'm not talking to the same person. And I actually had a personal experience about 2 years ago when I was working in where was I? I was working in somebody else's practice, and I had a preteen who was like 12, 13, and she had come over from Hawaii. And she had a relatively normal life, no history of trauma, but she definitely had DID. And when she would switch in session, when we would talk about the extreme bullying she experienced, which can be considered trauma, right? It was very obvious to me that she was a very different individual. She just did not sound the same, didn't look the same, didn't look at me the same. It was very frightening, and yet I remained very calm because I recognized that, okay, we are really dealing with some serious clinical data here, and this is not a game. You really and honestly do feel and sense and intuitively sense that I'm talking to a different person. Right? So derealization is the whole idea that everything around you feels false and manufactured. That also is a symptom of DID. And then we also have poor memory and amnesia, and that's an important thing to think about as well, because the individual may do things and then come back and say, I never did that. Now, there's one of 2 reasons why that could be happening. One is that they really do have poor memory because that is a symptom of dissociation, DID. Or dissociative identity disorder, or the other personality had been doing those things, and that's why the person doesn't remember that it was actually them that did it. So we're going to continue to talk about this all this week, guys, because I think it's important that we understand this from a clinical perspective, push all the pop psychology out of the way, because we don't need to be entertained, right? We need to know the clinical data. We need to look at what's really going on, and we need to take this extraordinarily serious or extraordinarily seriously. That sounds like a weird combination of words. But we're going to continue talking about this week, guys. Stick around with me. I encourage you to give this video a thumbs up if it was helpful to you. And go ahead and hit that subscribe button if you want to stick around with me with these videos. We're going to just continue talking about this stuff, guys, because it is so real. And there's a part of me that feels like, thank God I got a chance to see that some of this stuff is so real. And yet at the same time, I'm like, why me? Because I really don't want to know that multiple personality disorder or dissociative identity disorder can actually be present in a child. And so it is possible. And so I'm going to be talking about that all this week. So stick around. I will see you soon, guys. Enjoy your Monday. Bye-bye.